like to send the greetings and the appreciation of the Board of Interior Health to everyone who's here and who contributed to the outstanding work that we see presented and around the room in poster form. This is really, really important. It's remarkable that in fact this initiative has come together to be as fruitful as it has. It's almost a year ago since I stood before the steering committee and we began the process of organizing these projects and assigning individuals to these tasks. This work that you've undertaken is of critical importance to the profession, to the health system, and to the health authority. As you're now aware, the Health Authority and PQI program is founded on the principle that those who are providing care have the best opportunity to understand problems in care delivery and with patients can develop together solutions that will be effective. You've come to recognize, I'm sure, that the approaches and the rigors of hypothesis testing and methodological choice and randomized trials and systematic reviews actually are very different than the tools and the techniques that you've learned to do this kind of work. In fact, for those of us in medicine, the rigor and the discipline associated with improvement methodologies, whichever one you choose and whichever one you apply, are actually absolutely attractive because they represent the same kind of diligence and rigor that brought you into medicine in the first place. It also, though, builds on the foundation of your being a physician. The relationships with patients, the relationships with coworkers and colleagues. In fact, quality improvement is really about establishing relationships, and I think Ron said that earlier this morning. And we see this in the projects that have been done and carried out today. I was amazed when I actually had the opportunity to review some of the posters and listen to the presentations. There are posters and work that reflects activities IH-wide. It involves facilities, it involves communities. There's studies that are looking at diagnostic accuracy and getting people the right treatment at the right time. Assessing those deficiencies, the chronic liver disease, for example, where we're probably not doing what we should do, nor, in fact, screening people with osteoporosis. There's a whole section on care optimization. This is something that I never heard about as a practicing physician, although I guess I assumed that it was probably important. I left it to the anesthesiologist to do it. And it's proper optimization preoperatively for children coming into the operating rooms and postoperatively and after injury, for optimizing musculoskeletal strength for the assessment and the treatment of osteoarthritis. And of course, effective communication, both from the facility and into the facility. This is so important. There's a fair amount about treatment. A number of posters reflect activities in that regard. These are all highly important and highly relevant to the care of patients in British Columbia. Avitas Donabedian, a quality guru from many years ago, actually understood the importance of a recognition of the system in which care is provided. He also recognized that this was not something that you learned in school, and you probably didn't learn in the doctor's lounge of facilities where you trained. But an awareness of the system and the system design is critically important for us to carry on our work. But it's based on a foundation of commitment, a foundation and a willingness to improve and to see it through the patient's eyes, because they are the people that we serve. Certainly his observations are equally relevant to what our health system is like in British Columbia today, and probably really throughout the world. The understanding of systems and of issues, the things that you can bring as physicians to quality improvement inside organizations are absolutely important and critical. We, the board, and the CEO, Susan Brown, who could not be with us this afternoon, want to recognize and assure you of the value we put on your work and your ongoing commitment to improve care that we're all able to deliver to British Columbians. Thank you very much for your efforts and your outstanding achievements.